Speaking of which, there are more dangers that lurk in the continent. A new crisis has erupted in Africa. There is an outbreak of Ebola in Guinea and Congo. So far, 5 people have died in Guinea and 6 African countries are on alert. The Wuhan virus pandemic is far from over here, but the world may now be staring at a new epidemic. Our next report has more.
Health workers in PPE, mass disinfection drives, and a vaccination campaign. The world has become familiar with these sights in the past year. But these men and women are not fighting the Wuhan virus. They're fighting Ebola. It's back in Africa. New cases have been found in Congo and Guinea, 2 countries that were home to the worst Ebola outbreaks in history. Guinea announced it on Sunday. It has recorded 10 suspected cases so far, with 5 deaths. The country is still recovering from the last Ebola outbreak. And struggling with the Wuhan virus, the infamous Western Ebola outbreak began right here in 2014. By the time it ended in 2016, there were more than 28,000 cases and over 11,000 deaths. The prospect of a second onslaught has scared the locals.
I feel really surprised. Given the current situation in Guinea, we Guineans are struggling with the COVID-19 pandemic, and now with Ebola, it will be a real disaster.
I was in panic. I couldn't even control myself when I learned that Ebola has returned to Guinea because of what Ebola has made in 2013 and 14 in Guinea, Sierra Leone and Liberia. We are Africans, we are poor, and if diseases like Ebola or the coronavirus appear in Africa, it is only God who will save us.
Meanwhile, Congo has confirmed 4 new cases this month. At least 2 people have died. The earlier outbreak of Ebola lasted almost 2 years here and killed more than 2,000 people. An emergency vaccination drive has begun. More than 50 high-risk contacts have been given the shots. There are supplies to vaccinate 16,000 people, but it may not be enough. The World Health Organization has sounded an alarm. 6 African countries are on alert. This includes Sierra Leone and Liberia, both victims of the earlier Ebola epidemic.
What is critical is decentralizing the operations to the lowest level, making sure your operations are where the community are, and that the community owns the operations, that your work is community-centered and that you work with the community. A one-size-fits-all approach to community engagement isn't effective. Every community is unique, and engagement has to really, really be hyper-contextualized to affected communities. That's the lesson we learn each time, and each time we improve on that and need to improve on that.
Ebola has an average case fatality rate of 50%, though it can vary by outbreak. African countries are not completely defenseless. Vaccines and treatments have been developed in recent years. New treatments and surveillance systems helped in ending the last epidemic. But the early signs, this time, are worrying. Guinea has already declared its outbreak an epidemic. Bureau Report, WION. World is One.
WION is now available in your country. Download the app now and get all the news on the move.